Welcome to another session on the webinar series on palliative care guidance in COVID-19 pandemic. I'm Dr. Chitra Venkateswaran, Professor of Psychiatry and Palliative Medicine in Believers Church Medical College, Tiruvalla, Kerala. I'm also the Clinical Director of Mehak Foundation, a not-for-profit organization, and a board member of International Association of Hospice and Palliative Care. I will be speaking to you on the psychosocial aspects of COVID-19 and the need to identify and manage distress. The learning objectives of this session are to understand the relevance of psychosocial issues in COVID-19 with evidence, learn to identify and assess emotional distress and have knowledge of specific issues in COVID-19, learn to use the algorithm number 4 in the ebook to address and manage psychological distress, to have an understanding of spiritual distress and its management. I would request all of you to download the ebook from the link provided on the slide, and you can go through the algorithm number 4 when we discuss about it. I would also request you to go through the supporting document on psychosocial issues on page 42 once the webinar is done, which will give you more information. Let me begin with a story of any one of us. Take a moment to reflect on how one of us would respond in various roles in our lives when there is so much of uncertainty. It could be a change of role, not able to do the routine work that we do, and the thoughts worrying us as, am I doing enough? Am I able to help others? And if you're not going to help others, you're not able to go out to help others, that worries you. A mother who's worried about a daughter who's living alone and taking care of herself. A daughter who's worried about her old mom who's vulnerable and on her own, and she's really worried because she's also got other illnesses. Or one could be very anxious or sad and be very worried about the feeling of heaviness within their own self. There are alarming implications for each individual and the collective health during this pandemic. Emotional, spiritual, and social function is impaired in one or more dimensions. We are witnessing so many expressions of collective loss, meaning grief, blame, and anxiety. There are separated families, poverty, homelessness. One is bewildered and lost amidst the complete dread of a catastrophe. In palliative care, we are losing contact, touch, not able to offer presence to the most vulnerable. There is little time in the changing picture to be prepared for rapid disease progression and even for death. Let me come to a bit of evidence now. Two of the countries which faced so much of morbidity and mortality, China and Italy, have some surveys on psychological distress. The survey from China shows that the psychological impact on 53.8% of their respondents was moderate to severe, with 28.8% having severe anxiety symptoms, 16.5% reporting moderate to severe depression, and 8.1% reporting high levels of stress. The survey from Italy showed high levels of anxiety in 73.9% of those surveyed. The numbers were close to 3,500. The study also showed that the risk of psychological morbidity is higher among the elderly, the vulnerable, and women. Integrated psychological interventions on all levels were shown to reduce the risk of mental health morbidity and promote social stability. And that shows that how important it is to integrate interventions and be prepared to do so. Psychological issues can be expressed in several ways. They are expressed as emotional distress. They could be expressed as unhealthy behaviors in people. They can also be expressed during a pandemic as non-compliance with public health directives. When you are exposed to an external stimuli, your thoughts, your internal thoughts, or cognitions, as we say, change. And they affect your emotions, and they lead to change in your biological responses, and then it is expressed as a behavior. So this is the cycle in which emotional distress is expressed. So who is at the risk of developing psychological distress? In a pandemic, we are not able to reach out to everyone. So it's always good to know who's at the risk so that we can follow up them much better. So people who are quarantined or isolated, people who contract the disease, that's COVID-19, vulnerable populations. As I said before, the elderly, women, children, those with comorbidities, those having end-stage organ disease, cancer, HIV, all these are vulnerable populations and they're at a risk of developing psychological distress. If they are already having distress, there is a risk of exacerbation of the psychological distress. Those who encounter loss, so these could be anyone, including families, who lose someone to death or any kind of loss which is encountered. And of course, health workers and carers who witness and who themselves could undergo loss during this process. Let me now come to a concept called distress. I'm sure that all of you would understand distress in your own way, in the language or in the culture that you live in. Distress is an unpleasant emotional experience, which is always associated with impaired coping methods, which will affect functioning, which could be sleep, appetite, relationships, occupational and social functioning, sexual relationships. So it would affect various dimensions in our life and functioning. And these would be usually described as emotions when expressed by an individual. For example, you always say that a person is angry, or a person is worried, or a person is sad, person is hopeless, or person is blaming me, person is irritating me. So these are the emotions that is expressed and perceived by an individual. It can also be understood as categories. Categories are usually perceived by professionals who assess psychological disturbances. So they categorize these emotional reactions into specific disorders or disturbances like anxiety disorders, which could have panic attacks or panic disorder, depressive disorders, or into specific concepts, which is very common in a pandemic like burnout, grief, or existential issues or spiritual issues. This figure shows how one can move through the spectrum of being healthy to being ill. If you can see the line on the top from the green to the red, the arrow which goes, there are normal mood fluctuations, very familiar to each one of us. If we take it in our stride, cope with the inner and support from others, inner resources and support from others, and get on with life. If we start reacting, we could become irritable or nervous, sad, and then move on to anger or anxiety or feeling of hopelessness. And then when you reach the extreme end of the red color, when you become ill, then you start showing either aggression, excessive anxiety or panic attacks, or being depressed or even suicidal. This kind of a journey from healthy to being ill can be seen also in sleep patterns, in energy, and in unhealthy coping. Again, to just go through what I discussed now, we can look into the emotional aspects. You can see the symptoms that are described in that box. You can look into the physical expressions of psychological distress. Again, you can see like the increased heart rate, you have psychosomatic symptoms like you can have a gastrointestinal upset, you can have aches and pains, headache, you can have behavioral expressions like fatigue, other vague and uncomfortable sensations, changes in eating patterns, difficulty in sleeping. But the red flag signs are very important to know and to identify, because these are the ones which warn you whether they need specific attention and also to refer them to a specialist, like when they have agitation, confusion, disorientation, substance use, hallucination and delusions, which are the psychotic features, and of course the most important, suicidal ideation. We are witnessing and we are hearing many people, including health workers, resorting to taking their own lives during this pandemic, and which is so distressing. So let us now look into, what do we ask people? When you see that a person is distressed, how do we start communicating? Sometimes in such specific challenging situations, one feels very how do we ask people? So in COVID-19, I think once you establish a relationship, we should focus our questions after the initial introductions and using open-ended questions, specifically focusing on COVID issues regarding quarantine, isolation, any COVID infection in the family, any loss, and explore concerns regarding the same. Secondary adversities due to the COVID situations. Ask about what are the consequences, what has changed in life, what has happened in their lives in terms of economic stability, social relationships, availability of food, groceries. So there are so many things that get affected by the pandemic. And then go on to the individual vulnerability will be the questions on comorbidities. What kind of illness do they have, or how are they coping with those illness? What medications are they on? Any other issues related to mental health, substance use, especially alcohol use, etc. And use the nurse protocol, which I'll come to in a bit, which will help you in exploring deeper into their concerns and emotions. So I'm now coming into the nurse protocol. It is one of the ways you can establish a therapeutic relationship with empathizing, making sure of trust rapport, and finding ways to explore deeper into their issues. So if you look into it, name, that is the N, or mirror the emotions. For example, when they are showing an emotional expression, you can say, you seem very angry. So that kind of places them, they understand. And then the anger comes down a bit. You understand the emotion, saying that empathetic statement, I can imagine how stressful this is to you. So then when you empathize, they really understand that this person is understanding what I'm going through. You respect the patient's or the caregiver's feelings, saying that I respect your feelings. Support them by using words like, is there someone you can talk to about this? Especially for a family member who's very isolated and the patient is in a ward, the family cannot go to them. You can support them by asking and explore the emotions further by saying, tell me more about your concerns. That is a very open-ended question. So this simple kind of protocol can help you explore further into the issues. I just want to mention on specific issues which is associated with this pandemic, like stigma. Stigma means people are labeled, stereotyped, and discriminated against. They're treated separately, and there is a loss of status or identity. Here in the picture, you can see a doctor or a healthcare professional who's in a lift, which is actually, you can see the lift is said as corona lift and no else can enter into the lift. This is in India, and we have been witnessing quite a few incidents of discrimination. And I'm sure this will bring memories of such instances in your own setting. Stigma or discrimination can be directed towards people who have the infection, patients, families, healthcare workers, or anyone associated. Stigma leads to distress and further isolation, leading to spiraling further into distress. Let me talk about another important issue, which is a substance use disorder. Substance use is use of any substance, starting from alcohol, which is very common, and it would depend on your own settings. In the place where I live in, alcohol is very common. Alcohol use is very common. Individuals with a substance use disorder during the pandemic is at a risk for misuse, relapse, or development of a disorder. Isolation and lockdown can lead to acute withdrawals, and people can present in emergencies with withdrawals because they are not able to consume alcohol or any substance which they have been doing for a long time. They are also more likely to experience homelessness or incarceration. Those who are isolated actually can indulge in substance use. They can resort to, when they have anxiety or distress, what would happen is self-medication with drugs that they have, which may be unnecessary. Of course, people would take analgesics commonly for aches and pains or headache or fever. But when you use analgesics or any other medications unnecessarily, we should be careful. And in palliative care, especially, the use of opioids should be with caution. So we should monitor these things. Another important issue which is being reported these days is domestic violence and child abuse. It's being reported more and more. And we can also see support programs and helplines offering support. Confined families leads to conflicts in people or partners already having issues. They could be living already with a lot of conflict between each other, and such isolation and living in a small space, with constant interaction would lead into issues. And this could be due to problems precipitated by, again, as I said, substance use, which could be again the lack of availability and the person getting irritated by that. Loss of income. So there is a financial distress and people are worried how they are going to cope. Loss of roles and control. The breadwinning member of the family is not able to go out and make his role felt for the family. So he gets angry or she gets angry, and that is reflected within the family. There is also anxiety regarding fear of infection, and there is no sense of respite. What is going to happen, And then again, coming back to the space with the familiar faces, and then conflict happens. And of course, there is a loss of social connectedness, social support, and also of faith. You're not able to go to the temple or church or mosque like you would be going regularly, and you're not able to gain that kind of a support from faith. Sleep is another, physiological function which is affected even as, when you're in lockdown for everyone, including us. And sleep issues can actually aggravate or be part of psychological distress. So they could be part of psychological distress or stand alone because of poor coping. Depression and anxiety also can lead to severe sleep impairment, leading to poor quality of life. Sleep disturbances will cause fatigue, tiredness, poor concentration, impaired functioning and performance over the day, exacerbation of somatic or physical symptoms like malaise, tiredness, pain, aches, behavioral issues like irritability and anger. And once sleep disturbance starts, and then it again spirals into other areas of life, and then it is very difficult for the person to catch up without support. Another important dimension which I mentioned earlier in all our lives is spirituality. Spirituality refers to the way individuals seek and express meaning and purpose in life, and the way they experience connectedness to self, to others, to the nature, to the moment, and to the transcendent. All of us have our own inner ways of doing this. In a pandemic, this sense of connectedness is threatened and sometimes disrupted. So this can be due to disruption in routine, roles, work. They all impact one's sense of self. There's an inability to visit places of worship, because spiritual means for some is to practice faith and their religious rituals. So they are not able to go to places of worship. They are not able to partake in community activities. They are not able to do activities. Some people have much of meaning in, sports or pursuing creativity like music, painting. So all that could be disrupted. They are not able to go to their places of work, where work itself, the commitment and the compassion at work itself brings meaning to someone's lives. And also for children not going to schools. All these may diminish the sense of meaning and purpose in life. Social distancing, isolation, and quarantine prevent us also from visiting our loved ones, disrupting human connectedness. Many health workers will be forced to encounter situations where they have to tell grieving relatives, we did our best with the staff and the resources available, but it wasn't enough. Rather than what we usually say, we did all we could. And this is a seed of moral injury. So this is what burnout means. It could be traumatic and then lead to post-traumatic stress as well in many, if not all, of healthcare workers. Frontline healthcare workers, in particular, are at an increased risk of psychological morbidity like burnout and post-traumatic stress disorder as a result of taking a lot of responsibilities in COVID-19 pandemic. Balancing the duty of care for an individual against, allocation of resources or using, resources what is very little in our parts of the country is associated with moral distress in healthcare providers. Post-traumatic stress is usually identified by intrusive thoughts, avoiding reminders of the traumatic events, negative thoughts, and emotional reactions. Now, let me go into one of the most important parts of this webinar. I'm going to just talk about the algorithm 4. I hope you have opened it on the ebook. It's an easy to follow algorithm, and it can be used very easily in a challenging situation. So if you go through the algorithm, after the initial introductions and checking where people are, because communication is often using a phone or some other platform, technology-enabled platform. So check where they are and who is with them. Explore their issues using your communication skills, like I mentioned, the nurse protocol. Use reflective listening, open-ended questions, which give them an opportunity to narrate, and use empathetic statements often. Summarizing what you've heard from them is very important, as we do not have our usual nonverbal ways to let them know that we are listening, like nodding or facial expressions of agreement with them. So clarifying and summarizing are very important. Illicit symptoms, like we mentioned in earlier slides, fear, irritability, worries, low mood, lack of interest, sleep disturbance, palpitations, restlessness. Remember all those symptoms and behavior that we discussed. It is also useful to use a tool like distress thermometer, which is given in page 49 of the ebook, and it will also come in the next slide. This is a simple tool like a visual analog scale and scores distress from no distress to extreme distress There is 0 to 10 in the last 1 week. So you ask the person who comes to you, showing the distress thermometer, can you just rate or score your distress using these numbers, what you felt in the last 1 week from 0 to 10. So if one person scores below 4, the need is to help that person with psychoeducation and help them cope, to help strengthen their social support and promote daily activities. Sleep hygiene for sleep disturbance is given on page 50 and is an extremely useful way to help sleep disturbance, especially when it's mild. If the distress score is above 4, along with the above methods that I said, like psychoeducation, help coping, strengthen social support, promote daily activities, they will also need to be supported medications or specific psychological techniques, which is also given in the ebook. So this is the distress thermometer. You can see the thermometer with 0 marking no distress and 10 marking extreme distress. There are lists of the problem which you can check and adapt to your own settings to the COVID-19, specifically like isolation, lockdown, distancing, and the lack of social support, etc. So how do I support once I find out someone is in distress, especially those who score below? Let's look at psychoeducation. I'm sure as carers, many strategies are already familiar to you, but it will be useful for you now to jot down a few ways you would use in your settings, in your team as well. So like I mentioned before, main focus is to establish a strong relationship, even with the limitations of distancing and precautions of masks, etc. So communication skills like clarifying and summarizing, giving simple facts. The conversation should be a mutually agreed agenda, a two-way dialogue rather than only one of them speaking, and of course, helping in enabling coping. So what do we mean by education, psychoeducation? It is the process of giving information about emotional distress and illness as well in a way that enables active listening, easier acceptance, and further discussions. So you check the patient's knowledge of the illness, explain only what he does not know, and provide the details in short sentences in small chunks that he is able to understand and accept, especially of the diagnosis, and elaborate finer points in very easily understandable local language. Check the patient's understanding of the problem and also respond to the patient's feelings about the diagnosis. Assist them to verbalize and express the emotions, and take caution to provide realistic hope and realistic reassurance along with support. We should avoid false reassurance and giving false hope to people. Something simple that all of us can help others do is to help them cope. And this is also very important in some instances for ourselves, to help ourselves cope. So ventilation validation is one of the main techniques that you can use, which includes non-judgmental listening with complete acceptance. So if you want to ventilate, find out some support or a confidant that you can talk who will be able to give you a non-judgmental listening with complete acceptance. Use a problem-solving approach to prioritize the main problem and help facilitating the person to solve and address. Like we should find out what is the main issue now. Let us try to address that. So we should focus on the resources and not on the deficit. How do we do crisis management in emergencies? We should check on what can we do for the moment. So we set up small realistic goals every day and say and discuss, let's see how we can manage that. Try to use recovered patients as experts of the illness, especially those who recover can reassure others. Many people can gain and use their own strengths to support others, and use the family, which is the strongest support that we can strengthen. Use their potential very well. How can we help them use their strength in unusual circumstances? Help them find meaning in their role when everything seems to be out of control. And for the existential and spiritual questions like, why me? Am I being punished? I'm feeling so lonely. Is God angry? Help them in connecting inward. Look at the pebbles placed on top of one another. That is to build your resilience using your inner strengths. Connecting outwards, look into nature, look into others and gather strength from that. And connect upwards, looking into the universe, God, faith, and you can pray to God. So now I'm coming to the last slide, summarizing what we have discussed till now. Mental health issues are significant in the context of COVID-19, with specific challenges to be aware of. Identifying, assessment, and management of psychosocial issues can be carried out by the primary care team, and you need to refer only when there is a challenging situation or a complex issue that you cannot manage. Addressing spiritual needs is absolutely essential to deliver comprehensive or total care. And also, please check the algorithms and the supporting documents in the ebook, which are very easy to follow and use in practice. The next few slides have resources for further reading. Then you have resources for training also. You can go through these and you can gain more information regarding the psychological and other issues related to COVID-19 pandemic. Then you can also look into the contributors for this of Pallium India and PALLICOVID Kerala for the ebook as well as this webinar. And I would request all of you to go to the link which is given in this slide and give your feedback to the webinar so that we know how we can improve and improvise on these sessions. Thank you so much.